The topics we'll be discussing today, what is Lyme disease? More importantly, what gets forgot is Lyme disease and co-infections, which we'll discuss what those are. What kind of happens? What's the physiological response that's going on when we have this infection? Some common myths, or at least some common theories that have been presented in regards to Lyme disease. Why is it so hard to test for? I'm sure everyone's probably aware of that. It's that there's a lot of inconsistency, or there's a lot of scrutiny around testing for Lyme disease. What are some signs to be aware of if you think this is something you should be concerned about? And then we'll talk about some treatment options as well. Okay, so I wanted to bring a little bit of relevance to the topic here. So these are just two statistics that you can see here. Each year, more than 30,000 cases of Lyme disease are reported to the CDC for Pennsylvania. However, the CDC estimates the total number of people diagnosed with Lyme disease could exceed 300,000 annually. And Pennsylvania is the number one state in the United States for diagnosis of Lyme disease. So, yep. Another stat here, this is from actually the CDC. And just to provide a little bit of context here, basically, you can read this, but it just basically says since 1991, the rate at which people have become diagnosed with Lyme disease has doubled. And that's just alone. I know the numbers seem a little insignificant, just over 3.5 cases per 100,000, just over almost 8 cases per 100,000. But again, provide some context with that. Even the CDC is noticing a double in diagnosis, and the CDC, for lack of better words, criteria in diagnosis is, let's put it, not very sensitive. Okay. All right, so Lyme disease and co-infections. We'll give you a little bit of history about Lyme disease. The reason why it became, its name was developed was that Dr. Willie Bergdorferi found the first case in Old Lyme, Connecticut. And just to provide a little context, I know a lot of other practitioners grind their teeth when they hear this. When we refer to Lyme, it's not plural limes. So just a little bit of if you're trying to have a conversation with another, if you want to bring yourself to a little bit higher level of having that communication with another person, it's always a little helpful. But that's where it came from. 1980s. He found the first case. As you can see, it's a spirochete. The actual spirochete is called Borrelia burgdorferi, after Dr. Willie. It is a bacterial spirochete, so basically it has, you'll see a picture in just a moment, but it has a corkscrew appearance, and that's how it enters the central nervous system and other tissues like our heart, like our nervous system, like our muscles, because it will actually spiral into the organ or the system that it's attacking. So as you can see here, we talked about the common areas of the, it's basically, this is like the Latin name for the basically black-legged tick or deer tick. I believe it's Zooxys scapularis. But it most commonly affects joints, immune system, cardiovascular system, and the central nervous system when infected. Now over here we have a little bit of just some common co-infections. The most common co-infections for Lyme disease. So this is where we get into a little bit of confusion. People, when we say Lyme disease, they think that co-infections like in Lyme disease go hand in hand. They don't. So you can have a co-infection, such as your most common ones are your Borrelia, your Anaplasmosis, and your Babesia. These are some other co-infections: Poisson virus, Borrelia miyamotoi, Borrelia mayoni, Borrelia afzeli, Borrelia. Basically, someone invented it and stuck their name at the end here. Babesia microti, Bartonella hensley these are just a few to name. There's more. But realize again, just to kind of come back full circle, you can have a co-infection and you do not have to have the Borrelia burgdorferi spirochete. You do not have to have Lyme disease, which again is the Borrelia burgdorferi. So just realize that, and we're going to go over what exactly these co-infections are, the most common ones. Okay, so again, now we're going over the co-infection here, the most common co-infections. So number one would be Babesia, or if you're infected, you're considered to have babesiosis. This is a parasite, so it's caused by a protozoan parasite that are transmitted by the ticks. Most commonly, it's typically they're all vector transmitted, but it's less commonly seen through blood transfusion or transplacental, which we'll talk about in just a moment, connecting some of the myths with Lyme disease. But it's a protozoan parasite that can be transmitted typically through a tick bite. Babesiosis shares many clinical features with like malaria, and in rare cases, in certain cases, it can be fatal, particularly in the elderly who are immunocompromised. Symptoms can be more severe than expected with Lyme alone, and can include a fever, fatigue, chills. Very similar. The symptoms are very interlinked. It's hard to be able to, through symptomatology, say you have Babesia, you have Lyme disease. So the symptoms really go pretty hand in hand. The next common co-infection. So remember, the most common co-infections: Babesia, which we just talked about, Bartonella, which we're going to discuss right now, and then anaplasmosis. So again, if you have Bartonella, it's considered Bartonellosis. It's caused by a probacterium. So it's another bacteria like Borrelia burgdorferi. They're both bacterias. The Babesia is a parasite. This can be transmitted via a vector, meaning it needs to basically carry and transmit it. The tick or the lice or the flea needs to carry the bacterial infection and then latch onto you or bite you and transmit it. So just to be aware of, I'll talk about this, but we can get the bacterial infections more than just ticks. This is just a gram-negative. This just tells you a little bit more about what the Bartonella is. It's a gram-negative hemotrophic short rod-shaped bacteria. So, and then this just gives us again some symptoms, what you can be aware of. A lot of this can be like, so we can see that it's associated with fevers of unknown origin, typical and atypical, like cat scratch fever, which can also present itself. So one of the common things is the animal can transmit this to you. We can move on to the next. Okay, so Lyme physiology, what's going on here? So again, this is a vector, meaning typically what happens is, what is most commonly known is a tick will typically attach to a deer that carries the disease. It takes a blood meal. The tick carries a blood meal, then it either hops on you and bites you and now transmits that bacteria into your bloodstream. So that's the vector, needing the vector to spread. If you look up through the CDC, it typically takes 36 to 48 hours for a bacteria to enter the bloodstream. Some research has shown that in animal studies, let's at least give that the pretense, that the bacteria can actually enter the bloodstream in roughly around a 16-hour time period. It's hard to diagnose that right away. We'll talk about some testing that can do that, but that is the typical time frame. There's other bacterias or co-infections that have been shown to enter the bloodstream in even less time than that, again, through animal studies. So we talked about this. The bacteria likes the joints, it likes your muscle, it likes your brain by entering the nervous system, and it likes the myocardium or the tissue around the heart. After 3 to 32 days, the bacteria can spread via the lymphatics, and now this is when it can start attacking different organ sites. It can cause swelling, and it can pass, like we said, to other sites here. Some animal studies, like we said, have showed transmission 24 to 72 hours or even less. So something to be aware of. And as you can see here in the top picture here, picture A, that's just a photograph of a Burley Burgdorferi. So you can see it does have that, kind of looks like a snake, but if you had a 3D, a little bit more of a 3D picture, it carries that spirochete-like formation. And the picture below it is just with certain medications or certain treatments of actually the spirochete being killed, which we'll talk about. Okay, so Lyme presentation, what do we need to be aware of? So there's different stages here. Early stages, we notice typically a rash, neck pain, stiffness, fatigue, aches, headaches, slight temperature, PM temperature rise. Stage 2, we're now in the disseminated stage. This is going to be more joint pain, arthritis here. And then our late stage here, which now we're getting to neurological or cardiac involvement. Some typical signs just to be aware of is the major thing is nerve pain. Nerve pain that migrates. That's the biggest thing. So there's multiple diseases that cause nerve pain. So we could talk about Crohn's, we could talk about other irritable bowel diseases, we could talk about hepatitis, we could talk about rheumatic fever, we could talk about toxoplasmosis, we could talk about lupus. All of those that I just mentioned all can present with nerve pain. But Lyme disease is the only presentation that has migratory nerve pain, meaning you can wake up one day, you have nerve pain in your hands. Wake up the next day, now you have nerve pain down in the feet. That's the only disease that presents with that. So just be aware of that. That's a really good point. Some other things that it can present with, obviously we talked about the joint pain, muscle pain. It can create night sweats. That's another issue. Well, that's anyone who's sick, fever, irregular sleep patterns, low energy. So it's kind of hard to go off of those. The big ones would be the migratory joint pain, the night sweats, the air hunger, which means basically, I always ask that, everyone's like, what's that mean? For unexplained reason, you're having to catch your breath. I'm just walking down the hall and I need to give myself a second and catch my breath. It's typically, you should be able to walk down the hall and not become exhausted. So that influences that as well. Heart palpitations, if it becomes what's called Lyme carditis, that can start affecting, being a symptom is you're getting irregular heartbeats. But those are the major things to be aware of. And so we'll go over some myths here, or at least some things that are out there in research that haven't been 100% standardized, but things to be aware of in the literature. So ticks, are they the main, everyone talks about, I didn't get bit by a tick, I get bit by a tick. Do not necessarily need to be bitten by a tick. Yes, that's the most common vector, but there are fleas, black flies, infected water, even snails, mosquitoes, your pet gets Lyme disease, it gives you a nice slobbery kiss on the face and you end up, getting that in your mouth. There's theories and there's been research showing that it can be transmitted through the saliva. There is research and there is reports of blood transfusions, of people actually getting blood transfusions and contracting various Lyme and co-infections. There has been some research through sexual transmission. If your partner has Lyme disease, there has been some cases being reported of contracting it that way as well. So those are things to be aware of. It's not just a tick, okay? Obviously, everyone is kind of familiar with this here, the erythema rash or the erythema the erythema rash, which is most commonly known as a bullseye rash. You do not have to have this. So the thing that you need to be aware of the most is that don't look at any of these pictures. You could possibly have a Lyme infection without any presentation or without any subcutaneous presentation, okay? But the pictures here to show you, these are all various either Lyme and co-infection rashes. So they don't always have to present with the bullseye rash, okay? This is someone who thought they had shingles, and it was a babesiosis infection. Your Bartonella typically show in that striated pattern. So that's a pretty common presentation with Bartonella. And then these are just two other Borrelia burgdorferi Lyme presentations. Some other things to be aware of here. There has been some research here that transplacental infection of human fetus have been recognized for syphilis and leprosy. These two, syphilis and leprosy, are spirochetes as well. They have a spirochete bacteria. So as you can see, relapsing fever or in Lyme disease and babesiosis also can have been shown to be able to be transmitted transplacentally. So being aware of that. And then here's just some research. So that's something to be aware of. People don't really think about that if pregnant and infected, that could be something of concern. You gotta get out of it. Oh, just hit don't send, and then see if you can get back into it. Bear with us here with technical difficulties. It's bouncing, so just hit that PowerPoint. It should come back up, I'm thinking. Yep.
Sorry about that, everyone.
There we go, and then just bring it back. Perfect. So you're in Chrome, yep. Just hit right here for me, Aaron. Yep, bam, and then just bring us back there. Oh, what is it doing? Do it again.
There we go.
There we go.
Okay.
Beautiful.
Yeah. Thank you, everyone.
One more. Perfect. Okay. So some other issues to be aware of. Why is this such a hard thing to kill? So we're going to talk about some of these. So the big things are something called persisters and biofilms. Also, we'll talk about it in the slide. It's not on here. The ability for the bacteria to form what's called a cystic state and a round body state, which we'll talk about that. Don't let me move on unless I talked about that. Hey, Doc, you mentioned cystic and round body. So, anyways, first thing we're going to talk about here is persisters. So what is a persister drug or a persister bacteria? So small fractions of dormant bacterial cells that survive after antibiotic use, okay, after treatment, and the cells end up, or the bacteria ends up regrowing and leading to what's called post-treatment relapse. So through the CDC, you cannot diagnose nor call something chronic Lyme disease. If you're being by the book, it's considered post-Lyme treatment relapse. So it's post-Lyme treatment relapse. So basically, we can have persisters. There's certain drugs that are used to help kill persisters and specifically attack persisters. We'll talk about that. Actually, since we're on it now, I'll mention them. So some of those would be something called like methylene blue. There is something called disulfiram. Another one would be daptomycin. These are all really good for killing persisters, but these are all, when we start getting into the antibiotic realm or the drug realm, you need to be very, very careful. You need to make sure you're with a practitioner who's aware of what's going on, running proper blood testing. For some of these drugs, you need to have blood work monitoring every 2 weeks for the first 2 to 3 months, running a CBC and CMP. So all that I know is probably like, what did he just say? The point of that is that you need to be with a practitioner who knows how to monitor this appropriately and to dose appropriately as well. Okay, so let's talk about biofilms here. So what are biofilms? This is a lovely picture of a biofilm. As you can see, that mucus attachment as it strings out and covers the bacteria that it's basically protecting. So this is a microorganism that adheres to the surface of an object in moist environments and begins to reproduce. So as we build that biofilm, the biofilm is basically making more of itself and kind of spreading even further throughout the bacteria. And also it talks, it's able to talk to each other. So it is able to communicate to another bacteria and basically helps that to survive and helps that to keep from getting destroyed. So biofilms are pretty nasty. So as you can see here, the microorganism forms an attachment to the surface of the object by secreting a slimy glue-like substance. Okay, so there's some other things that we can do to kill biofilms. I'll talk about that. I actually have that put into the end here. Things that we can do actually naturally to kill biofilms as well. Okay, so that's why one of the aspects, well, why is this so hard? We have persisters of Lyme and co-infections, and we have biofilms that are formed. Also, I didn't forget, the Lyme disease has kind of two states, a cystic state where it can be killed pretty easy, and then a round body state. So this is kind of the explanation I give. So you have a biofilm. Think about this being the spirochete. The biofilm will basically cover that spirochete, and it makes it difficult for the immune system to detect it, and it also makes for it to be killed because it has a shield protecting it. So we use things to help dissolve that shield, and now we can kill the Lyme disease. Also, there's states. So there's states, the cystic form and the round body form. So think about the round body like a cinnamon bun. It curls up and it basically protects itself so that it can't be killed. So that's another issue that we have to address. So that's why sometimes pulsing therapies or doing programming specific stop times, which are also called pulsing, helps basically tricks the spirochete. Okay, I can now come out of round body state. I can go and have fun, and then you reintroduce the therapy again. Okay, so I'm definitely not going to pronounce that. It's just a Herxheim reaction is typically what it's known. Or also you may know it as herxing, or you may know it as detoxing, or you may know it as, this really stinks, I'm sick, die-off, thank you, that's what I was looking for. You may know it as die-off, I never call it die-off, I said, yeah, you're herxing. So these are all synonyms with Herxheim reaction. So basically this is can present with fever, sweating, muscle pain, joint pain. It's basically, so this is a good thing. I tell my patients, if you're herxing, this is good. But depends on the severity, if we need to give you some support, whether it be NAC, glutathione, ALA, things to help push detoxification and to support the herxing, we can do that. But remember, this is a good thing. So I always tell my patients, if you're feeling better, that's a good thing. If you're herxing and feeling worse, that's a good thing. The thing we don't want is if we're just stagnant, we don't notice any difference. That's when we want to be concerned. So herxing is a good thing, But as you can see, like we talked about, these are things that we can use to prevent herxing, glutathione, NAC, doing IV Myers helps, ALA, DIM, clay, bentonite clay, and activated charcoal are all helpful with decreasing the symptoms of herxing. But remember, herxing is a good thing, but just not a ton of it because we don't want you to suffer too much. Next year. Okay, so I'm going to try to keep this as simple as possible. We're going to dive into some of the testing and what the testing does and what we're looking for. I'll try to, again, keep it pretty concise and quick, but I feel like this is such a really murky topic. Like people don't really understand what's going on in the Lyme testing, and you don't really need to understand it to the degree. That's for me, but if you understand a little bit of it, it helps. It goes a little bit, goes a long way. So when we're looking at Lyme disease, we have antibodies, or more commonly known as immunoglobulins. So we have a T cell on acute bite. We have a T cell response. Okay. Typically, we're not measuring that because no one really gets tested in time. You can do testing. So there's two gold standards when it comes to testing. We use Medical Diagnostic Laboratory. They do a great job, and they're really affordable. The other company is IGeneX. Those are two gold standard tests when it comes to Lyme disease. IGeneX is a very, very good test. They do a lot of really good things. Unfortunately, to most people, it's not feasible. They do not cover through any insurance, and their pricing, to be honest, is a little. It's very, very good testing, so I can't badmouth it, but it's tough. It's tough for a patient to come in and be okay with that.
What about DNA connection?
We do a little bit. We have done some with them, and we have found that the MDL has been superior, far superior. Yeah. So in this stage, what you could run, you could do any type of PCR should pick up this. You can look for T cells, but they're not as sensitive. The best thing would be to do if you just think you just got infected would be an IGeneX immunoblot. Okay. Or excuse me, an IGeneX spot. An IGeneX spot. My apologies. There's like 40 of them, but it'd be an IGeneX spot test or PCR. Now we're getting into the testing, which is more commonly to pick up. So now we're getting into the mid stage. This is going to be your IgM immunoglobulin. So I just tell my patient, think of IgM as like an acute response. Really, this is the acute response, but it connects. It's easier to understand. So we can actually look for this immunoglobulin on certain tests, okay? Then we start to transition into the IgG immunoglobulin. This is the later stage. We would call this, again, chronic Lyme because we can't. Remember, we have to call this accurately post-treatment Lyme relapsing, fever or relapsing treatment. But to be aware, we can test for all of these. But this is typically the stage and the antibody response to the testing. So the big issue here is standard testing lacks sensitivity for early and late infection in Lyme disease. So it does a pretty good job for around here, but the other spectrums, it just lacks the sensitivity, okay? So some testing statistics to kind of bring some relevance here. The mean sensitivity for all tests and for all samples was 59.5% and 53.7% when doing the two-tier methodology. I'll talk about that in just a second. We'll bring this full circle, but you can just see here the sensitivity for the two-tier, which is the criterion, is 59 and 53%. Not the best numbers here. Again, it talks about the two-tier testing. Just bear with me, I'll connect the dots. The two-tier test generated over 500 times more false negatives results than the two-stage testing for HIV. So meaning they tested, it said they didn't have Lyme disease. They retested them with another test which showed that they did have Lyme disease. So false negatives. Okay, so remember we talked about that 2-tier testing system. I'm going to talk about this and provide a little bit of information. What is the 2-tier testing system from the CDC? This is what happens. I apologize, it's a little fuzzy, but I'll be able to read this through. So you think you have Lyme disease. The first thing what they'll do is they'll do an ELISA test, okay? The ELISA is basically called an inclusion or exclusion test. So what happens is if that comes back positive, typically what happens here is if you have that positive, you then move on to what's called a Western blot. But if that ELISA comes back negative, typically through standard medicine, you're done. No more testing. There is no reason to continue to evaluate your diagnosis of Lyme disease or co-infections. And a lot of times, if you go to standard medicine, they won't even run co-infections such as like we talked about, your Babesia, Bartonella, anaplasmosis. Never mind to name, the rest, which I'll go, don't get me started. There's a lot. So there's a lot of information coming out on, just so you're aware of, like Borrelia lone starri, the Lone Star tick. Basically, it causes people basically have aversion. You basically start to attack yourself if you consume any meat. Another one that's starting to gain headway is Borrelia miyamotoi, and then another one is Borrelia tuxieri. So those are just to be aware of. Anyways, back to our CDC criteria, and I digress. So we have our ELISA, right? We become negative, you're done, no more testing. We become positive, now you move into the next criterion where we do what's called a Western blot. This is a more accurate test. It gives you a little bit more of an idea of what's going on here. So typically what they'll do here is if you had symptoms for 30 days or less, you do an IgG and IgM Western blot. If you have symptoms for 30 days or more, they do an IgG Western blot only. Remember, IgM, acute, IgG, chronic. So acute, so they test acute and chronic for less than 30 days. More than 30 days, they just do the IgG. And then at this point, this is where it gets a little bit confusing. So at this point, if you have two of they only test 3 bands. They only test 3 bands in standard medicine. If you have 2 of them, of the 3, you are considered to have CDC positive Lyme disease. Okay. If you have 1 of them and not the other 3, and if you have 1, you don't have Lyme disease. Okay. For IgM, you need to have 5 out of the 10, and there's a lot more than 10. There's a lot more than 10. I'll talk about the most common ones here in a second. But again, if you have 4, you don't have Lyme disease. So it's something to think about. And again, the major issues here, that it has good specificity, meaning in the world of research, it means that it does a pretty good job saying that this is Lyme disease or this is not Lyme disease, and it does a pretty good job saying if this is negative, it is negative, but it has very poor sensitivity. So very poor sensitivity for picking up actually Borrelia burgdorferi. Very poor sensitivity in picking up other co-infections. As you can see here, the ELISA is 70 to 75, Western blot 70-75%. Overall sensitivity to the overall test is roughly around 50%. And then we use something called a C6 peptide, which has around 79.6%, which isn't bad. But overall sensitivity is just too low. That's why we use, if we use medical diagnostic laboratories, we make sure we run your ELISA, we run your Western blot, IgG and IgM, we run your C6 peptide, which is another basically protein associated with Lyme disease, and we make sure we run all of your co-infections and even some of those kind of wacky ones that I commented, such as the TwoTier, the Miyamoti, the Lone Star, Lone Starry, and more. And if needed, we can do IGenics. So testing, this is just a little bit more of kind of the, what I would say it falls in the myth category, but things to be aware of. So even in testing a spinal tap, which is kind of considered one of the gold standards for diagnosis, circulating immune complexes, basically it creates, the spirochete can create circulating immune complexes, which decreases the ability to find antibodies in the spinal fluid of Lyme patients. So just be aware of that. Like the disease can actually use the immune system to kind of go in stealth mode. So here's just kind of reinstates that. So basically what this means, it evades the immune system via long replication time, causing changes in other surface proteins. So basically it causes it to be like a cloaking mechanism. So it surrounds itself with the body's immune system. In this case, it surrounds it with lymphocytic proteins, so it can't be detected. So all that to say that these are pretty creative buggers that can actually use our body to go in stealth mode, so to speak, from the immune system or from detection. Okay, so prevention and resolution. So let's talk about some prevention though. If you're going to be out in the woods, you're going to be hunting, let's take proper measures. But if you can avoid that, if you can kind of prevent yourself from, hiking in the long grass and going out and hunting, that's great. But we want to live our life and not, be confined. So protective clothing, wearing hats that wrap around and protect the back of our neck, wearing long sleeves, long pants, pretty easy stuff here. I'm not the biggest fan of it, but doing permethrin sprays, not on your skin, on your clothing. So if you're going out and hunting, I'd take my jacket, take my pants, probably give that a good spray down, get out of there, let everything dissipate, but that way it's embedded in your clothing and then you can throw it on. These are other helpful sprays here. So the Avon SSS or the Picardin on the skin. I would prefer, if it's me, I'm going to use a essential oil tincture, garlic, eucalyptus, thyme. Those would be my three, and I would repeat that every about 4 hours if I'm out. Yes.
What is the permethrin spray? What is that?
Yeah, so it's basically like intense DEET. So it's I definitely would not recommend putting it on your skin. I don't think they recommend that either. But it basically is a repellent for ticks specifically and can kill ticks.
There's a wash too that you can get to wash your clothing.
Yep. And I think there's actually clothing that you can buy that has it already in it, I believe.
How effective are the sprays that are DEET free? Just for even like mosquitoes.
Yeah, it varies. We have one that's in the Mechanicsburg office that's really, really good. I can't picture the name of it, but I can picture it's like a gray, gunmetal gray bottle with a green label. I can't think of the name of it. I don't know if you can remember, Erin. Yeah, the smell. Right. Right. So that's
everybody around you.
Right. Yep. But that's why I would go with making my own tincture. Garlic, eucalyptus, thyme. Get it in a little spray bottle, and you just I would keep it in my pocket every couple hours. Spray it on me.
What do you mean by guinea hens?
We're going to talk about that in a second. So if you want to go to the extreme, you buy a couple of these suckers here. They eat ticks. So you have so I know. Yeah, that's right. So Dr. T will tell you he has a couple patients who actually have guinea hens in their backyard, and they keep their guinea hens in their backyard. So it's like their little, their little home security for ticks. So guinea hens, I thought I'd throw that in here. In avoiding perfumes, they are attracted to the fragrance. They're more likely to jump on you. Also, common questions that people ask. So, should I get tested if I find that it's been crawling around and it wasn't embedded? I would still take caution and probably get evaluation, especially if fever or anything like that. Obviously, a rash starts to be avoided. But if you just caught it and you saw it jump on you and and you're able to pull it off, you're more than likely okay. In another aspect, if you do find it, don't throw the tick away. Try to hold the tick. If you have like an old medicine bottle or even a plastic baggie, throw it in there. You can test the tick for Lyme disease. Okay? So a lot of people don't realize that. So those are two aspects that people don't realize that. You can either take it to, basically if you have someone that you know, just contact me and I'll get it done for you basically. But you can take it to a local LabCorp or a local Quest, and you can tell them, can I have this tested? If you come to me, I have to put a diagnosis code on it and et cetera, et cetera. So I don't know if you could bring it into the LabCorp. I don't know the regulations and policies, but I know I could send it in for you. But you might be able to. You could just call up a local LabCorp or a local Quest and ask them, hey, if I found a tick, would I be able to bring that in? And they'll probably say, yes, absolutely. But if all for naught, everything else fails, let me know. I'll make sure we take care of you. Okay.
What percentage of ticks are infected? Any idea?
That's a really, really good question. To be honest, I do not. I personally would take it with the growth and the expansion. You get bit, that tick is infected. That is how I look at it.
Misconception, the brown dog tick compared to the transmitted disease.
Yeah, any tick that uses blood meals to survive can transmit it. If it can carry a blood meal and it can bite you, it can transmit it. Absolutely.
You named the 3 garlic, eucalyptus,
Yep.
and
Yep. Yep. Put them all. I put them all together in one tincture. Give it a good shake.
Are they all
and spray?
oil? Get it in oil?
Yep. Yep. You can get these all in oils. Yep. These are. Yep. Exactly. Okay. We'll go on to the next here. Okay. So biofilm killing and more. So I told you we would talk about that, right? So some really good biofilm killers. Remember, that's the one that spreads out like a web, and it then will kind of spread even further, and it protects the spirochete. Remember, it forms the shield. Some things that we can do: oregano oil, cinnamon bark, clove bud, stevia. I like to use something called Biocide. Really, really good. There's been some good research with actually it's showing its ability to kill biofilms. So that's why I started that.
What is that?
It's a product. It's a tincture product.
Oh,
Yep.
Just get it at the drugstore.
No, they probably won't carry it. You can Google it. I don't know if they sell it like over the counter. I think it's only practitioners or licensed practitioners able to purchase that. But I could be wrong. I just know what works and what I use. It's for my patients.
And that's an oil.
This is a spray.
A spray.
Yep. Do I have it over there?
It's not there, it's in the closet. Should I go grab it?
Oh, it's right here. So this is the pump spray. I use a dropper. They're the same exact thing, but this is it right here.
And what is that?
This is the Biocide.
Do you just take that in general, or
You
do
take
you think?
you take it in conjunction with the protocol, the program that you're on.
Okay.
Yep.
So you take that internally?
Yep. Just like a breath mint.
as a supplement or?
Like, so it would be if you have Lyme disease and you're coming to our office, you're put on a regimen. You're not giving just one thing and say, off you go. So it would be as a supplement, yep, in conjunction with the everything else that you're doing.
Okay.
Okay, so then you can also look, you may have heard of the Cowden protocol, the Brunner protocol, Byron White protocol. These are all natural remedies or tinctures or Chinese herbs that helps kill Lyme disease. Basically what they are, here's your first one. This is the Cowden. It's used cemento, banderol, hutina, and a couple other herbs that help basically that build on top of each other. But basically, it's you work your way up to 30 drops 2 times a day, and they start to add some other herbs. But these are the main 3. This is going to be the Brunner protocol here, using cemento, using Japanese knotwood. Most people don't realize resveratrol and Japanese knotwood are the same thing. Andrographis, and you basically work your way up to 3/4 of this product per day. But the other aspects that I would use here is artemisinin, curcumin, again resveratrol, Japanese knotwood, teasel, lauricidin, which is helpful with biofilm killing as well, but you have to be careful. That can make you herx. That can make you herx as well. So these are some just natural remedies that you can do. We typically use, if we use tinctures, we use the Beyond Balance protocol. We found that those are really, really effective. We've used the Cowden, we've used Brunner, we used Byron Whites. We've tried that. We've seen some really good success with using the Beyond Balance products. Just aware here, if you're using tinctures, they have less side effects, but you're in for a longer haul in using them. So the analogy I give is, if we give you antibiotics, that's like a sledgehammer putting a hole in the ground, or that's like a sledgehammer, there's a bug here, it's a sledgehammer, it's gonna leave a big hole afterwards, right? I consider tinctures like a fly swatter. It's still gonna leave a mark, but I'm not creating any damage to the wall, right? So that's the analogy that I give.
But then, when it takes longer,
Yeah.
do you have to be concerned about damage?
Right. So that's all things to be aware of, and that's a very good point. And that's what I bring up to my patients. I just make them aware, like, this could take longer. It might create more issues. But typically, if we can start you on a tincture-based approach and dose you up rapidly, pretty quickly, without herxing you too much, you're typically in the clear.
How do you get the resveratrol? I mean, is that like a oil or what?
No, you can buy this in multiple forms. You can buy typically what we use is a liquid form. You can get like the reduced form, which is a capsule. I wouldn't recommend that. Typically, I'd recommend getting resveratrol in a liquid form.
Because my dietitian said the only way to really get it is either in the red grape juice or in red wine.
Yeah, or so if you're trying to get it through wine,
How much are you getting? I mean, how much of that would you need to equal, like, a glass of wine?
Yeah. Bingo. Try a couple. Yeah. So it's very minimal. No, couple bottles.
Oh.
Couple bottles. Yeah. So it's nice in theory, but I'm gonna go with the resveratrol unless I've had a rough day, and I'll just use it as an excuse and say I'm getting my resveratrol today. Not much. No, not much.
Why did they tell you that?
It's a selling tip. Yeah, it's a selling tip. Okay. So let's move on to the next slide here. Okay. So those are some things that were directly to treat Lyme. Okay, right? Or naturally. We can use antibiotics. That's to be honest, that's a whole nother conversation for another day. I did talk about some persister drugs, remember, that we could use. If you could remember back, it was the methylene blue, it was the daptomycin, the disulfiram. But remember, those are making sure you really have someone who knows what they're doing if they're using those.
Is that prescription?
That is, those are all prescription. Yep. And there's some other aspects that we can use. You can use, obviously, doxycycline is the most commonly used, and they basically, if you get diagnosed, their recommendation is about a 3-week use, if that, of doxycycline. Good luck. Good luck. So I would not recommend taking that approach, but doxycycline is used pretty frequently. Your Plaquenil, Ceftin, these are all medications that are used typically either as monotherapy or in conjunction together. I would suggest, if you're trying to kill Lyme or co-infections through a monotherapy, even with an antibiotic, it's going to be hard. It's going to be hard. But that's a whole nother kind of talk for a whole nother conversation. But those would be some big ones. And then if you're looking at co-infections, typically the best ones for co-infections are going to be rifampin, minocycline. Those are the two big ones. You can do rifaximin, that's another one, but those are going to be your two big ones.
I have a question.
Mm-hmm.
So it's, to my understanding, it's a balance, because I'm told that you can take an antibiotic,
Mm-hmm.
but then again that just totally wipes out the good
Mm-hmm.
and the bad.
Mm-hmm. Mm-hmm.
So
Yep.
then you have to rebuild the body.
Yep.
And I'm told that, and I don't know if this is true or not, that there are some people that can be bitten by a tick
Mm-hmm.
and have no repercussions from that because their immunity is so good.
Yeah. Yep. Absolutely. I have a couple patients with that. I run an MDL. They come back. I have a couple patients that are actually CDC positive, and I'm like, hey, you're CDC positive for Lyme. They're like, oh, I feel great. I didn't even know. And that's where it comes into, well, the clinical aspect. Well, do I let you go? Do I treat you? Do I start shaking the tree if nothing is really presenting? So that's a really good point. And we're going to lead right into that right now. This slide kind of ties it in. So if we're looking at Lyme disease, we talked about, again, those tinctures and a natural approach. We talked a little bit about antibiotics, but addressing it with the 3 I's. So the 3 I's, which are going to be, I might have just skipped that. It should have been earlier, but that's fine. I got it. So 3 I's are going to be infection, removing the infection, inflammation, and immune system. So addressing and removing the infection, addressing the inflammation and downregulating inflammation, and regulating the immune system, because we've now caused the immune system to go haywire. But other things to other aspects to focus on here. We get so caught up in killing the disease about the health of the host. So these are all things that should be addressed and should be looked at when dealing with Lyme disease. So looking at, again, this is the infections, removing chronic infections, removing or shifting out of dysbiosis, gut dysbiosis. Then we run into also like food allergens, that's involved in the infections. We run into the environmental toxins, that kind of falls under the infections. And then we move into the inflammation, leaky gut, sleep irregularities, nutritional deficiencies, endocrine disorders, neurological dysfunction, postural orthostatic tachycardia, POTS syndrome, mitochondrial dysfunction, really important addressing that. That all comes under the inflammation in the eyes, which kind of the immune system, which kind of plays with inflammation and immune system. Autoimmune dysregulation obviously falls under the immune system. Pain syndromes. So as you can see here, there's a lot going on other than just killing the bug, right? There's taking care of the gut, there's addressing food allergies, there's sleep, there's toxins, there's nutritional deficiencies. Autoimmune shift, the big one being mitochondrial dysfunction that people don't realize, that needs to be addressed. So there's all these things that need to be addressed other than just killing the bug. I would tell you right now, if there's one thing you can take from the talk today, it's that we get so marred down into killing the disease, we forget about the host of the individual. And that leads into the last slide, just driving it home. And this is my favorite movie of all time. I love this movie. You treat a disease, you win or you lose. You treat a person, I guarantee you win no matter what the outcome. So again, it just drives the point home. We can't forget about treating the person. We can't forget about treating the individual. We can't forget looking at the mitochondria, looking at the leaky gut, looking at gut dysbiosis, looking at endocrine disorders, looking at a shift towards autoimmune dysfunction. So really important to remember, it's not always just Lyme disease, spirochete infection, kill that. Look at,
Why don't healthcare professionals do that then?
right. You're looking at,
No, I mean.
right,
the-
right,
The other
Right,
healthcare
right.
professionals.
right, yeah. And that's why it's starting to become so rampant. That's why it's become the issue that it has. Also with other environmental things, so I won't get into that, gets into a rabbit hole, but that's definitely one of the main factors. So again, if you could take home one thing here, Patch Adams, treat the person.